This is Professor Capron. Welcome to this presentation on premature ventricular contraction. Let's review the learning objectives for this presentation. By the end of this presentation, you will be able to identify the key ECG characteristics of PVCs, understand the physiological mechanism causing PVCs, assess the clinical presentation and management strategies for patients with PVCs, and recognize related conditions and their significance in the occurrence of PVCs. There are just a few key terms for this presentation. Please pause the video, make sure you do get these down. If you're still struggling with any of these after the presentation, please come and find me in class. Let's discuss the key ECG characteristics of premature ventricular contractions. The rhythm on an ECG appears irregular due to the presence of premature ventricular beats. These premature beats interrupt the normal, regular rhythm of the heart, causing an overall irregular pattern. This irregularity is one of the first indicators that PVCs may be present. One of the hallmark features of PVCs is the appearance of the QRS complexes. They are typically wide and bizarre looking. The QRS duration in PVCs is greater than 0.12 seconds, which is longer than the normal QRS duration of 0.06 to 0.12 seconds. This widened appearance occurs because the PVC originates in the ventricles, causing a slower and less organized spread of the electrical impulse compared to the normal pathway through the His-Purkinje system. PVCs occur without a preceding P wave. This is a significant characteristic that helps to differentiate PVCs from other types of premature beats, such as premature atrial contractions. In a normal cardiac cycle, a P wave precedes each QRS complex, indicating atrial depolarization. However, in the case of PVCs, the premature beat originates in the ventricles, bypassing the atria, and thus no P wave is seen before the wide QRS complex. Following a PVC, there is often a compensatory pause. This pause occurs because the heart's natural pacemaker, the SA node, resets its timing after the premature beat. The compensatory pause is typically a longer interval between the PVC and the next normal beat. This pause allows the ventricles to fill properly with blood before the next contraction, helping to maintain cardiac output despite the premature beat. Now let's look closer at the physiology of premature ventricular contractions. PVCs are caused by an ectopic focus in the ventricles. An ectopic focus is an abnormal site within the heart that initiates an electrical impulse prematurely. Unlike normal heartbeats that originate from the SA node, PVCs arise from the ventricles themselves. This abnormal initiation site is outside the regular conduction pathway, leading to early depolarization of the ventricles. In a normal cardiac cycle, the SA node generates an impulse that travels through the atria, AV node, and then the ventricles, leading to coordinated contraction. During a PVC, the ventricles depolarize prematurely, disrupting this coordinated process. This premature depolarization causes the ventricles to contract before they have fully filled with blood. As a result, the PVC is often felt as a skipped or extra heartbeat because the subsequent contraction is typically less effective in pumping blood. The premature contraction interrupts the normal rhythm of the heart. This can be seen on an ECG as an irregular rhythm due to the early occurrence of the PVC. Because the ventricles contract out of sync with the rest of the heart, the overall rhythm becomes irregular, contributing to the skip beat sensation that patients often feel. Common triggers are things like stress. Emotional or physical stress can increase the likelihood of PVCs. Stress activates the sympathetic nervous system, which can increase the heart rate and make the heart more prone to ectopic beats. Caffeine is a stimulant that can increase heart rate and stimulate ectopic foci in the ventricles. High intake of caffeine-containing substances like coffee, tea, or energy drinks is a common trigger for PVCs. Imbalances in electrolytes, particularly potassium, magnesium, and calcium, can affect the electrical stability of the heart. These electrolytes play crucial roles in maintaining the proper electrical gradient across cardiac cell membranes. An imbalance can make the heart cells more excitable and prone to premature depolarization. Hypokalemia can increase the risk of ectopic foci and subsequent PVCs. Hypomagnesemia can lead to increased excitability and arrhythmias, and hypercalcemia can affect the duration and strength of cardiac contractions, contributing to irregular beats. Now let's look at the assessment and presentation of PVCs. Patients with PVCs often report feeling palpitations. This is described as an awareness of the heartbeat, which may feel like pounding, fluttering, or irregular heartbeats. The sensation of palpitations can be distressing for patients, even if the PVCs are benign. PVCs can also cause a sensation of a skipped or missed heartbeat. This occurs because the premature beat is often followed by a compensatory pause, which allows the heart to reset and fill with blood before the next normal beat. During this pause, the patient may feel like their heart has stopped momentarily, which can be alarming. Most patients with PVCs are hemodynamically stable, meaning that their blood pressure and overall circulation remains within normal ranges, despite the presence of PVCs. This stability is because PVCs, especially when infrequent, do not significantly affect the overall cardiac output or blood flow. In cases where PVCs occur frequently, they can cause significant discomfort and anxiety for the patient. Frequent PVCs can sometimes lead to decreased cardiac efficiency, which might cause symptoms like lightheadedness or fatigue. This is more common in patients who have underlying heart conditions. Continuous ECG monitoring is essential for detecting the frequency and pattern of PVCs. This is especially important in patients who report frequent palpitations or who have known cardiac conditions. Routine ECGs can also be used for patients who have intermittent symptoms or during regular checkups. The ECG will show the characteristic wide and bizarre complexes associated with PVCs. These complexes occur earlier than the next expected beat, disrupting the regular rhythm. By monitoring the ECG, healthcare providers can determine how often the PVCs are occurring and if there is a particular pattern, such as bigeminy, which is a PVC every other beat, or trigeminy, which is a PVC every third beat. Documenting the frequency and pattern of PVCs helps in assessing whether they are increasing or decreasing over time and in response to treatments. Analysis of the ECG can also help to identify any underlying conditions that might be contributing to the occurrence of PVCs, ischemia, or structural heart disease. Now let's look at the medical management of PVCs. Many PVCs are considered benign, meaning they do not pose a significant health risk and often do not require any specific treatment. This is particularly true in patients without underlying heart disease. In healthy individuals, occasional PVCs can be a normal variant and do not usually indicate a serious problem. For asymptomatic patients or those with infrequent PVCs, observation and reassurance are often sufficient. These patients should be monitored regularly to ensure that the PVCs do not increase in frequency or severity. And patients should be advised to report any changes in symptoms or new onset of related symptoms, such as increased palpitations, dizziness, or chest pain. In cases where PVCs are symptomatic and cause significant discomfort or anxiety, antiarrhythmic medications may be considered. These medications work by stabilizing the cardiac membrane and reducing the occurrence of premature beats. Common antiarrhythmics used for PVCs include drugs like amiodarone. These medications should be prescribed and monitored by a cardiologist due to potential side effects and the need for careful dosage adjustments. Beta blockers, such as metoprolol or atenolol, are often used to manage symptomatic PVCs. These medications help by reducing the heart rate and decreasing the excitability of the heart muscle. Beta blockers can be particularly useful in patients who experience PVCs due to increased sympathetic activity, such as those with stress or anxiety related triggers. The dosage of beta blockers needs to be carefully titrated to balance symptom relief with the potential for side effects, such as bradycardia or hypotension. Identifying and correcting electrolyte imbalances is a crucial step in managing PVCs. Common electrolyte disturbances that can trigger PVCs include hypokalemia and hypomagnesemia. Treatment involves supplementation of the deficient electrolyte, either orally or intravenously, depending on the severity of the imbalance. Regular monitoring of electrolyte levels is important, especially in patients who are on medications that can affect electrolyte balance, such as diuretics. Stress is a common trigger for PVCs. Effective stress management techniques can help reduce the frequency of PVCs in susceptible individuals. Techniques such as mindfulness, meditation, yoga, and counseling can be beneficial. Encouraging patients to engage in regular physical activity and to maintain a healthy work life balance can also help manage stress levels. Educating patients on lifestyle modifications is a key component of managing PVCs. This includes reducing or eliminating the intake of stimulants such as caffeine and nicotine, which can exacerbate PVCs. Encouraging a healthy diet rich in fruits, vegetables, and hydration can support overall heart health and reduce the likelihood of PVCs. Now, let's focus on the nursing management of premature ventricular contractions. One of the primary nursing interventions is to identify potential triggers that may be causing the PVCs. Common triggers include stress, caffeine, nicotine, and electrolyte imbalances. Assess the patient's lifestyle and habits to pinpoint specific triggers. This can involve asking about their daily intake of caffeinated beverages, their smoking habits, their stress levels, and their diet. By identifying these triggers, we can help the patient make necessary adjustments to reduce the occurrence of PVCs. It is essential to monitor the frequency and pattern of PVCs. This can be done through continuous ECG monitoring or regular checkups. Keep track of the number of PVCs and any patterns that emerge, such as their occurrence at specific times of the day or in response to certain activities or stressors. Documenting the frequency and patterns helps in evaluating the effectiveness of interventions and making necessary adjustments to the care plan. Reassuring patients about the benign nature of PVCs is important, especially if they are asymptomatic or experiencing only occasional PVCs without any underlying heart disease. Explain that PVCs are common and often do not indicate a serious condition. This reassurance can help reduce patient anxiety and stress, which can in turn decrease the frequency of PVCs. Regular monitoring of vital signs, including heart rate, blood pressure, and respiratory rate, is crucial. This helps to assess the patient's hemodynamic stability and detect any signs of deterioration. Frequent checks ensure that any significant changes in the patient's condition are promptly identified and addressed. Educating patients on lifestyle modifications is a key aspect of nursing management for PVCs. Patients should be advised to reduce or eliminate caffeine and nicotine, manage stress effectively, and maintain a balanced diet rich in essential nutrients. Encourage regular physical activity, as exercise can help to reduce stress and improve overall cardiovascular health. However, patients should be advised to avoid excessive exertion, which can trigger PVCs. Teach patients to recognize and avoid triggers that may precipitate PVCs. This includes being mindful of their diet, stress levels, and other lifestyle factors. Advise them to keep a symptom diary to track their PVCs and identify any potential triggers or patterns. This can be helpful in making informed decisions about lifestyle changes and interventions. Let's look more closely at the patient presentation in PVCs. When assessing a patient with PVCs, it's crucial to monitor their heart rate and blood pressure regularly. Although PVCs often occur in otherwise healthy individuals and may not significantly impact vital signs, they can occasionally indicate underlying cardiac issues. Continuous monitoring helps detect any abnormal changes that could suggest a more serious condition. Regular checks ensure the patient remains hemodynamically stable. Patients commonly report feeling palpitations, which are sensations of the heart skipping a beat or fluttering. These sensations occur because the premature ventricular contraction disrupts the regular rhythm of the heart, causing a noticeable pause before the next beat resumes. The feeling of a skipped heartbeat is due to the compensatory pause that follows a PVC. This pause allows the heart to reset its rhythm, resulting in a stronger than normal heartbeat that patients often perceive as skipped or irregular. Some patients might experience dizziness, especially if PVCs are frequent or if they occur in runs. This dizziness can result from brief periods of reduced cardiac output when the ventricles contract prematurely and inefficiently. Most patients with occasional PVCs can maintain normal activity levels without significant limitations. Remember, PVCs are often benign and do not typically interfere with daily activities. However, some patients may feel discomfort or anxiety when experiencing PVCs, particularly if they are frequent or symptomatic. It's important to reassure these patients and provide education on managing symptoms and reducing triggers. Encouraging patients to engage in regular physical activity while monitoring for any exacerbation of symptoms can help to maintain cardiovascular health. Let's look at some related conditions and their significance. Stress is a significant trigger for premature ventricular contractions. The body's response to stress involves the release of adrenaline, which can increase heart rate and make the heart more susceptible to arrhythmias, including PVCs. Both acute stress and chronic stress can contribute to the frequency of PVCs. Managing stress through techniques such as relaxation exercises, meditation, and counseling can help to reduce the occurrence of PVCs. Caffeine is a stimulant found in coffee, tea, energy drinks, and certain medications. It can increase heart rate and induce PVCs by stimulating the heart's electrical activity. Individuals who consume high amounts of caffeine may notice an increase in palpitations or the sensation of skipped heartbeats. Advising patients to monitor and potentially reduce their caffeine intake can help manage and decrease the frequency of PVCs. Electrolytes such as potassium, calcium, and magnesium are crucial for maintaining normal cardiac function. Hypokalemia can disrupt the electrical balance of the heart cells, making them more prone to arrhythmias, including PVCs. Other electrolyte imbalances like hypocalcemia or hypomagnesemia could also contribute to PVCs. Regular monitoring of electrolyte levels, especially in patients at risk for imbalances, is essential for preventing and managing PVCs. Treating and correcting these imbalances through dietary adjustments or supplements can help to reduce the occurrence of PVCs. PVCs are more frequently observed in individuals with existing heart conditions, such as coronary artery disease, heart failure, or cardiomyopathy. These conditions can alter the structure and function of the heart, making it more susceptible to arrhythmias. The presence of PVCs in a patient with heart disease may indicate an increased risk for more serious arrhythmias or worsening heart function. Comprehensive cardiac evaluation and ongoing management of the underlying heart disease are crucial to address the root cause of PVCs, prevent potential complications. Recognizing the various triggers and related conditions that contribute to PVCs is vital for effective management. By identifying and addressing these factors, we can help to develop targeted strategies to reduce the frequency and impact of PVCs. So let's do a little summary of what we've learned so far. PVCs cause an irregular heartbeat due to the premature contractions. PVCs are characterized by QRS complexes that are wider than normal, typically greater than 0.12 seconds, and these complexes appear abnormal and are not preceded by a P wave. Following a PVC, there is usually a compensatory pause where the heart resets its rhythm before the next regular beat. We looked at what causes PVCs. PVCs originate from an ectopic focus in the ventricles, meaning they start from a location outside the normal conduction pathway. This leads to an early depolarization of the ventricles, causing the premature beat. This disrupts the normal timing of the heart's electrical cycle, and because the ventricles depolarize earlier than expected, the usual coordination between the atria and ventricles is disrupted, leading to the characteristic irregular rhythm. Remember, PVCs are often benign, especially if they occur infrequently and do not cause significant symptoms. In some cases, PVCs can cause symptoms such as palpitations, dizziness, or discomfort, and this may require medical attention. Frequent PVCs, or those occurring in patients with underlying heart disease, can increase the risk of more serious arrhythmias or heart dysfunction. So we need to identify and reduce triggers. And remember, common triggers for PVCs include stress, caffeine, and electrolyte imbalances. Identifying and minimizing these triggers can help to reduce the frequency of PVCs. Continuous or routine ECG monitoring can help to track the frequency and pattern of PVCs, and patients should be reassured about the typically benign nature of PVCs and educated on lifestyle modifications that can reduce triggers. In cases where PVCs are symptomatic or frequent, medications such as beta blockers or antiarrhythmics may be used to manage the condition. Treating any underlying conditions such as electrolyte imbalances or heart disease is also crucial. Thank you so much for paying attention to this presentation. Make sure that you're standing up every now and then and walking around. Don't just stay sitting all the time that you're studying. Remember, I'm super proud of each one of you. Now get out there, go do some nursey things.